I'm Dr. Kevin Kavanagh from HealthWatch USA and would like to talk to you today about the rise and impact of measles in the United States in 2025. Unfortunately, we don't even know the actual number of measles cases in the United States. It's just not known. The CDC places this number at just over 1,000, but infectious disease doctor, Dr. Paul Offit from Philadelphia, places this number at approximately 3,000. And this is from him talking to his colleagues on the ground and in the field. So we have a very, very large outbreak. I would say it's larger than the outbreak which took place in 2019. And of course, we're still getting more and more cases. Measles, as many of you know, is the most contagious disease known to mankind. It has an R naught between 12 to 18. That means that one case of measles in a community that doesn't have immunity and there's not mitigation strategies, one case of measles would be expected to infect 12 to 18 individuals. Now, this compares to, for example, Ebola, where one case of Ebola would be expected to infect 1.5 to 2.5 individuals, and seasonal flu, that on average, one case would infect 1.3 individuals. In many areas of the United States, we have lost herd immunity to measles. It requires 92 to 95% of the population to be vaccinated or immune to this disease for herd immunity to take place. And this isn't on average, this is in every community. And we certainly have some communities, such as in Western Texas, where this immunity has been lost. And if you have a drop in vaccination rates of, let's say in those communities, of 10 to 15%, then this virus is going to spread like wildfire, a very dangerous situation. So if you are immunosuppressed, I would definitely recommend not traveling to regions in the United States that have low vaccination rates, such as rural Western Texas. Now, according to the IDSA, which is the Infectious Disease Society of America, 1 in every 20 cases of measles will result in pneumonia. 1 in every 1,000 will develop brain swelling. 3 in every 1,000 will die. And before the availability of the vaccine, each year in the United States, there were 500 deaths and 48,000 hospitalizations. One of the complications of measles is post-infection immunosuppression. Now, this is not a theoretical outcome. It is something that commonly happens. This measles is designed to attack the immune system. According to the American Academy of Family Practice, measles can suppress the immune system, eliminating 11 to 73% of one's antibody reserves. So the disease targets our immune cells, the plasma cells, the cells which remember past infections and allow us to quickly respond to them. So you may, for example, have had chickenpox, and then you develop measles. Well, with chickenpox, you should have been immune, but once you develop measles, you would then lose the immunity that you developed to chickenpox because the measles has zapped or killed off your plasma memory cells. There are at least 2 studies that have come out which have found that this type of immune damage can last for years. Now, another complication of measles is called subacute sclerosing panencephalitis. And this is a highly fatal brain disease. And although it's rare, it's like a ticking time bomb that can occur up to 10 years after the infection. The diagnosis is dependent upon the patient's physical examination and history, along with laboratory testing. And in laboratory testing, the levels of antibodies in the brain's cerebrospinal fluid is compared to those in the patient's blood or serum. And then they plug the values into a formula. Dr. Myvold sent me this yesterday, and this is the formula that they use, and depending upon the results, will give the likelihood that this patient may be at risk for getting subacute sclerosing panencephalitis or SSPE. There have been at least 3 measles deaths in the United States, 2 of which were in healthy children. Thus, it's not just those with comorbidity who are at risk of dying of measles. Measles is a childhood disease, and so when you talk about the deaths from measles, you're talking about children primarily. The adults should be immune at this point. That's if they had the vaccine or if they had the disease. Myself, I had measles. But the vaccine, believe me, is a much better way to acquire immunity. Now, there was also one adult who died, and I believe that the old narrative, and you hear this with COVID, that, well, the deaths were with and not from COVID. Well, with measles, the deaths were from measles, not with measles. Now, one of the big problems is that herd immunity is rapidly decreasing and evaporating in the United States, especially in certain regions. And this places immunosuppressed individuals at risk because our current vaccine to measles is the MMR, which is measles, mumps, and rubella. And this is a live attenuated viral vaccine. This vaccine cannot be given to immunosuppressed individuals. And because of that, they are at risk. They were dependent upon others to keep them safe. And at this point, it's like playing Russian roulette if they go into these communities where the vaccination rates have fallen. If you just have one person in the room that has measles or is spreading the virus, it is likely that almost everybody else in that room will become infected. This, again, is one of the most contagious diseases known to mankind. Now, there was an inactivated measles vaccine initially, and this was between 1963 to 67. Unfortunately, this vaccine did not have the durability or efficacy what was required to keep this disease under control. Because of this vaccine is no longer offered. If you were vaccinated back then between 63 and 67, it is recommended that you get an updated measles vaccine. Now, there is ongoing research to try to determine if an MMR and varicella vaccine can be given to a subset of liver and kidney transplant patients. Now, note, both of these vaccines are live attenuated virus vaccines. And there is evidence which suggests, and the key word here is suggests, that this can be done safely under certain circumstances. Vigano et al. Described some of the immunological parameters which need to be met and tested for before an attenuated MMR or varicella live virus vaccine can be considered to be given to kidney and liver transplant recipients. The authors also warned that there are concerns regarding safety and that there is a lack of efficacy data. In other words, there still may be substantial safety concerns with immunosuppressed patients, and even if conducted safely, we cannot be certain of the vaccine's effectiveness. So personally, I would only consider that option if I were able to obtain this vaccine at a very large university medical center and I lived in an area such as rural Western Texas. Now, if an immunosuppressed individual is exposed to measles, one of the options is to get passive immunity or to obtain intravenous immune globulin to measles. This is a table from the Washington State Health Department, which lists a number of protocols which can be used. Now, if you have a normal immune system, take a look at the bottom line, and you can actually get an MMR vaccination. Now, you'd have to have your exposure within 72 hours, and you'd have to be over 1 year of age. But if you're exposed to measles and unvaccinated, an MMR vaccination could still be given, and that would provide you with some protection from severe disease. Now, I should also add that one of the other strategies that can be used is called ring vaccination, and that's where you try to make sure that your coworkers, your families, and your friends are vaccinated so that at least the people who you come in contact with will not be infecting you with the measles virus. Now, I'd like to now address some of the common areas of vaccine misinformation that have been circulating in both our communities and on the internet. This table is from a recent Kaiser Family Foundation survey, which was performed in April of 2025. They found that 19% of the public mistakenly believes the measles vaccine is probably or definitely more dangerous than getting an infection. 25% of the public mistakenly believes the measles or MMR vaccine probably or definitely causes autism. 25% of the public mistakenly believes vitamin A was probably or definitely effective in preventing measles. And this misinformation has been hyper politicized in that 76% of Democrats are worried about the measles outbreak compared to only 28% of Republicans. So as you can see, it is extremely hard at this point to get the United States to the point where you have 92 to 95% of the individuals immune to measles. I think we've got a lot of work to do and trust to rebuild with public health because the measles vaccine is an old, time-tested vaccine. It should be very easy to convince people to get this vaccine. This is a dangerous disease, but yet what we're seeing is great resistance in our communities. Now, another bit of misinformation is the narrative that vaccines have not undergone clinical trials. All vaccines have undergone clinical trials. And new vaccines have undergone placebo-controlled trials. This was even true for the polio vaccine, where over 600,000 children were given the vaccine in a placebo-controlled clinical trial. Now, I should note that testing of all vaccines against a placebo is not ethical. If there is no existing alternate treatment, a placebo-controlled trial can be considered. But if there is an existing treatment, testing against the existing treatment is what is needed. Now, I'd like to give two examples. Let's take the Ebola vaccine, which is under development, and the measles vaccine. Ebola infections are highly fatal. In some outbreaks, the death rate has approached 90%. And that's not counting the chronic disability in those that have survived the infection. Now, I agree with a large number of ethicists that having a no treatment control group would not be ethical. The vaccine has a high likelihood of providing benefit, as in the no treatment group, there is a high likelihood of death, and those that survive would likely be disabled. With the measles vaccine, if a new vaccine were to be developed, it should be compared to the existing vaccine, so you can determine the vaccine's true benefit. And giving a patient a placebo for a dangerous disease when a treatment already exists is unethical. So for example, with measles, they may change the adjuvant. If that was done, you'd need to have a new vaccine. We need to test that vaccine with the old vaccine, not to a placebo. You wouldn't know if it was any better or any worse than the existing treatment. Now, some of the older vaccines, such as flu and COVID, require updates for new strains on a yearly basis. In this case, only the antigen in the vaccine is changed. And if extensive testing is done, there will be delay in antigenic drift in the circulating virus. And this could make the vaccine ineffective. And I'm very much concerned that this is what we're going to see this fall, is that with the extensive added testing for these vaccines, we're going to have a vaccine when it comes out that won't match the strain of the virus that is circulating, or will be several strains and mutations away from what the vaccine was developed to treat. So to summarize, testing of vaccines must follow ethical standards. Insisting on unethical studies, such as performed in the Tuskegee syphilis study, does not make sense, and it doesn't make the vaccine safer. You need to maintain clinical equipoise so that each arm of the experiment has an equal chance of benefit. And that is one of the basic concepts in scientific research. The illustrations in this slide are from a site called Unbiased Science. I would suggest using some of their illustrations and information when you're communicating to the public. Now, the second narrative that we're hearing about vaccines is that vaccines cause autism. There is no association between vaccines and autism. This was demonstrated in a large Danish study from the Staten Serum Institute, which evaluated 6,517 children with autism. The rates of autism were not different between the vaccinated and the unvaccinated groups. Another study was published in the Journal of Child Psychology and Psychiatry. Here they studied rates of autism in the city of Yokohama, Japan. MMR vaccinations, which is the measles vaccine, these rates plummeted until there was not a single vaccination given in the city in 1993. However, the rates of autism did not decrease. Instead, they increased, with a dramatic rise in the 1993 cohort. Again, more evidence that there's no relationship between vaccines and autism. Now, vitamin A, this does not treat measles, and this is a false narrative when you hear people saying it will treat or prevent measles infections. The benefit of treating measles was shown in one study in Africa where vitamin A was administered to malnourished children. In that situation, it was of benefit. However, in normal, healthy children, or children who are not malnourished, it will not be of benefit. And we're already seeing in Texas, children being hospitalized with measles and being treated for vitamin A toxicity and liver toxicity. So similar to iron and oxygen and vitamin D, a small amount of the substance is necessary for life, but too much can cause toxicity and even be fatal. So now I'd like to talk about the federal response. Now, federal communications regarding measles has not been good. I feel that they've been minimizing the severity of the disease. At one point, the Secretary of Health and Human Services even praised a doctor who was treating patients while the doctor was actively infected with measles. This not only places the children at risk, but downplays the danger of infection. We're also seeing a defunding of public health to a substantial degree. There have been steep cuts in the Centers of Disease Control and Prevention, which could see its budget reduced up to 40% under the new administration's proposals. The CDC reportedly had to scrap plans to help one Texas school system deal with a measles outbreak because of layoffs at the CDC. The CDC is also cutting funding for state health departments. In Kentucky, $150 million is proposed to be cut from health departments in the state. We cannot effectively respond to disease outbreaks and epidemiological and epidemic threats with our health departments being underfunded. And we're seeing this right now taking place. People are being laid off. We have less individuals working at the CDC, and it's now becoming very difficult to obtain data. And not collecting data is becoming a huge problem. The federal government, in a variety of different scientific areas, is not collecting the data anymore. It's an out of sight, out of mind mentality. This has affected everything from drug use to maternal mortality to climate change. Public health has been directly affected. You've seen the FDA not recently publicizing an E. coli outbreak in our food supply, and the CDC has suppressed at least one measles forecast, which also encouraged vaccinations. And I think you'll find that the data is becoming harder and harder to find. And this is an extremely dangerous situation because it not only affects your response because you don't have data to guide your response, but it affects your messaging to the community and public because you don't have data to really back up your statements and recommendations. And finally, vaccines work. Vaccines have been one of the greatest success stories of modern medicine. Since 1975, an estimated 154 million lives have been saved with vaccines, and most of these lives are children. That equates to 9 billion years of life saved. The consequence of abandoning of public health strategies are now really only becoming apparent. And unfortunately, it is our children who are going to be paying the heftiest price. So as said in an old Chinese proverb, if we do not change our direction, we are likely to end up where we are headed. So thank you very much. And at this point, I will entertain questions.